One of the things that really concerns me, I suppose, around the overall health service is the cost-benefit analysis that's done on the decisions that are made. And it is not obvious to me that there are correct cost-benefit analysis done on some of the decisions. And this includes some of the decisions to close, like district hospital beds and all of that. So looking at what impact will that have in the short, medium and long term. Is there a way of the HSE supplying to us or supplying to committee or members of this committee exactly what elements are used within the cost-benefit analysis? And I think that would help us to maybe understand, because I don't have confidence in the cost-benefit analysis models that are being used, either being used for the closure of beds or being used for the centralisation. And I take what you said earlier on around the centralisation of services and the improved outcomes, and I would certainly agree with you. But I think we need to see the sacrifices that are made for that in terms of access to healthcare in rural areas. And then the importance of putting in the services, and I welcome what you said in terms of services being delivered at a local level where they are safe to do so. We haven't done that. We have failed dismally to do that.
On the cost-benefit analysis side, I can't speak for what the HSE have used, but I can offer a view of generally the common factors that we see health systems considering when they're doing service change. That can relate from either very centralised tertiary services or even down to more localised services, such as ones we've been involved in, either the use of telecare, the use of telehealth more locally to help shift out of care, or different views of how paramedics and ambulance services can contribute to the system. And I would effectively highlight, I think, 6 factors that generally come up. The first is about quality, and underneath that there are the clinical outcomes, the patient experience, and the patient safety. So what impact is the change, be it a service change or a policy, procedure or regulatory change, going to have? The second one is access, and we've talked in the questions you were raising about what does this mean for remote communities, and for some services they need to be very local, in others you need the clinical volumes to get the good outcomes. The workforce to provide it, and we have discussed that, and part of that workforce is also the education and training requirements. So the junior doctors, the trainee nurses, the allied health professionals, they need to see the right amount of patients to train, and also if you're a training establishment, your productivity will be different because people need to it needs to reflect that. The fifth one then is about the financial side and the net present value, but that is, as you see, one of 6 factors. And the final one being deliverability, which we've talked about the next steps and the feasibility, be it a massive building programme or a big requirement to train up, create a workforce. How is this thing going to be delivered? And that's just at a national level. It's equally applicable at a local level if you're setting up a GP-led health centre or a more local hospital. Does it practically, can you deliver this in terms of infrastructure, IT, estates, timing, and things like that? So I would say those are the 6 that we would say repeatedly come up, and then there will always be, depending on the level at which you're doing it, particular local issues, be it there may be a particular thing about health inequalities in a particular area that needs to be addressed, which would mean you design the provision in that area slightly differently. So that would be my our general view of the cost-benefit analysis, but as I say, we can't speak to exactly what HSE would use.